Hi everyone, I'm Dr. Pragati and today I'll tell you about my community medicine residency. So it's been about 3 months I have joined the community medicine residency. And to all the aspirants who NeetPG aspirants and who have given NeetPG recently, who are in the dilemma of selecting a branch, I don't know I am a right person to give you guidance about it, but since I have already joined and been here for 3 months, I think I can give you a little bit of insight about community medicine. So our day starts around 9 o'clock. We go to our respective OPDs, there are 4 OPDs we have to handle in community medicine. One is immunization OPD. Second one is immunization OPD is divided into 2 parts. It is one for IPC, in which we give child immunization, and the second one is anti-rabies vaccination OPD. Then we have a separate OPD at urban health center and one at rural health center. So the OPD timing, which is around like 9 to 1 o'clock, we go and see the patients, we vaccinate them. If we are in the immunization OPD, we vaccinate child, we vaccinate all the person for come for dog bite or any kind of animal bite. Yeah, it is under us. Like for JR1, JR2, we'll give vaccination. In our hospital, we give vaccination by ourselves and not the nursing staff. Then at the urban health center and rural health center, we usually have interns and all, and there are respective MOs in those OPD who are permanent or might be temporary, allotted by the government of India or Maharashtra government. So basically they handle the OPD. We go by and see, like we have the postings for 3 months at respective OPD. So we'll go for, if I am been posted for urban health center, so I'll go for 3 months and we'll see the patients and give drugs accordingly. Like we'll manage a basic level patients like diabetes or hypertensive patients or fever, cough, cold. In rural center, we refer patients for refer patients to tertiary healthcare hospital. But in urban centers, we have the separate OPDs there only at that center. So we'll just refer them to another OPD if we want. Okay, so this is for 9 to 1. Then we'll go to the department after our lunch, and then we have a PG activity which is about 3 to 5 or sometimes 2:30 to 5 o'clock. PG activity consists of different types of we have a certain theme for a particular month. Like for this month we have the health planning and management theme. Before this month, I think we had infectious disease was the theme. So we'll have all the seminars, micro teachings, PG activity related to that theme of that month. So then what the PG activities consist of, there is we read journal club. In journal club we read the particular article selected according to the theme and selected by our guides. We'll read it thoroughly from whatever given in that article, and we'll discuss it after the article is read. someone among us will go and present the article, and then we'll subjective or objectively decide how well he has read, and how was the article, and how author has what are the objectives, limitations, and stuff, conflict of interest, and everything about that article. We'll discuss about it. Then we have micro teaching. Micro teaching is about only 10 to 15 minutes, maybe less than 10 minutes also. It consists of 6 to 7 slides, and we have a time bound thing. We have to finish it within 10 minutes. It is about small topics, just say one thing about leptospira, or I presented the micro teaching about health planning cycle, which is a very small topic, but which can come at SAQ or something in the exams in final year, for which we can give a in-depth, not in-depth, but in generalized knowledge, so anyone can write that SAQ based upon my micro teaching. Okay, so then we have seminar. Seminar is generally very long. It can take about 1 hour or more than 1 hour. It consists of around 40 to 50 slides, and it is very in-depth knowledge about any topic. For recently there was a topic about monitoring and surveillance. There was a seminar on monitoring and surveillance, and there was also a seminar on machine learning. I remember I have not given any seminar yet, but according to this month timetable, I have been allotted to give seminar. So I don't know, it just requires very in-depth knowledge, and we have to go through so many references, and in general understand the concept behind the topic, and should be able to do justice with the topic and explain it thoroughly to the others. Okay, now then in between we have quiz activities, and today was our definition quizzes. So there we have prepared 50 cheats of some topics like monitoring or surveillance or communicable disease or something nutrition as a heading, and then the cheat was there. Someone has to pick that cheat. If he got the cheat of the, like for example, I got cheat of the specificity. So I said the definition of that I said the definition, which is, I don't remember much, but it is about identifying the true negative, specificity about true negative. So likewise everyone took the cheats, and if they are not able to answer, they can pass the cheats. This is some new thing our guide has started, but it was good because in final year everyone said that will be asked about definitions, and we should know the definitions, as our subject consists of so many definitions and terms. So yeah, there is this. Then other thing was quiz. There was a quiz. There were 4 teams, and each team consists of 3 people, and each team consists of 3 people. Okay, and then we also there was also this thing, pass system, or you have to rapid fire type answers questions, then we have to answer it accordingly, rapid fire thing. Then yeah, so it was all about the quiz, and then we also got prize and stuff. I didn't participate because I was very new, and I thought that quiz is something very like they'll ask me and something, but it was very fun quiz that if you don't know, your team will handle, or if you are not sure, then we can pass. It's not like anyone can judge you for something. Yeah, that I learned, that no one is going to judge you even if you don't know something. Yeah. So then again, what we have in PG activities like we also have a month-end examination. every month we have to give a exam about that theme. Like I said that this month theme of health planning. So then we'll have month-end examination, like 4 to 5 SAQs, 1 or 2 LAQs question, like we'll have in the final exam. Yeah, that type of questions we'll have, and it is around 2 to 3 years exam usually taken on end of the month. Like this month it is planned to be taken on 30th of September. So wish me luck. Okay. Okay. And what are the different things we have? Yeah, we also have a guest lectures. We have so many of guest lectures from airport faculties, airport staff. We have guest lectures. So many of community medicine people are there in the airport staff who monitor food hygiene, food safety rules, international guidelines. They told us about international guidelines and stuff. Then there was another guest lecture. It was about cervical cancer and its rate, how can we prevent it. One gynae ma'am came to us, and she very beautifully, I like that guest lecture. She very beautifully explained all the things about cervical cancer and obstetric and gynae health. There was another guest lecture, but there was 4 to 5 lectures of airport faculties only. One guest lecture was from the district collector hospital or district administrative officer, from the office of DHO, about the malaria, chikungunya cases and how can we control it. And he explained very in depth about what goes in the system, how system handles everything, how each and everything is considered while framing the plan or evaluation of the system, or evaluation of it, or all the services all other services are properly implemented or not, and everything he told. How administrative, he gave insights on administrative work goes in the community medicine. Yeah, that was a good lecture. Yeah, we can say yeah, it was a good lecture. Okay, so, and there are also some fun things we have in between. Panel discussion or group discussion is also there. Then we'll discuss it in the group, how it is done and stuff, and that thing. Yeah, basically all the things. The motto is not only understanding the topic, but the motto is also, it so much gives us about the, it so much gives the confidence for stage presence and public speaking and confidently speaking. I love that aspect because I previously when I was MO, I used to be like, no, I cannot speak anything. But now I am very vocal. I like to talk about some things, but the confidence when we are in front of so many people, that comes like continuously doing this kind of things, like in if you see seminars or micro teachings, you have that mic in your hand. There are so many people are going to ask you questions or say some critiques and also praise you. There are so many things, so it will just develop continuous exposure, and then you'll be like immune about stage fear, or you'll be able to talk nice smoothly, or you'll learn about public speaking. That is a good thing. That is a good thing about this thing, and hope so. I think by the end of this year, or maybe 4 to 5 months from this time, I'll be able to properly properly speak in front of so many people without fear and my nervous voice and stuff. So that was all about the PG activity and community medicine residence. Then we go home after 5. We also have a call duties.